largest healthcare provider in India. 55 hospitals across the world. Touches 75,000 patients every day. Over 20 million patients successfully treated. The human body is a complex, intricate network, and keeping pace with its ever-changing demands is the Apollo Group of Hospitals. Racing ahead with in-depth research programs, high-class infrastructure, and equipped with the best in the medical fraternity, Apollo Hospitals is a clear pioneer in the field of healthcare, making it the third largest chain worldwide. The two Apollo hospitals established in Bangalore stands testimony to the city, with one of the hospitals accredited by JCI and NABL, both a gold standard in patient care, safety and clinical inputs. World-class healthcare infrastructure and expertise in cardiac science, neuroscience, oncology, joint replacements, organ transplants, including renal and liver, pulmonology and critical care, has made Apollo Hospitals, Bangalore, the preferred choice of patients seeking integrated and advanced healthcare facilities. The Cancer Center at the Apollo Hospitals, Bangalore is unparalleled. Besides the advanced PET-CT, the center is also equipped with the latest TrueBeam SDX 1.6, the only one available in Asia. This radical and powerful new approach in the treatment for cancer targets faster, accurate dosage delivery, thereby reducing the number of sittings in radiotherapy and radiosurgery.
Cancer has always been a dreaded word. It strikes terror. Even more so because you see it so often killing people in the movies. Every time the director wants to kill somebody, cancer comes in handy, doesn't it? But do we really need to be scared of cancer? How serious is it? Given all the technology, the advances, diagnostics and treatment, and even more importantly, the tremendous talent we have here, is cancer manageable? Is it curable? Will you get back to the way you were before you were diagnosed with cancer? I am sure you have a whole lot of questions. Now, who better than Dr. Narasimhaiah Srinivasaiah, or Dr. Simha as he is popularly known, to answer these questions. Dr. Simha is a very famous colorectal surgeon who has over 2 decades of experience across Europe and US. He has worked at some of the most premium and well-known institutions there, and he has come here with his rich experience to throw light on cancer. Should you be scared? How often should you go for a checkup? And how you make sure you're safe and never get to the stage 4 that everybody dreads? Dr. Simha, let's begin. Who is at risk? And does it really help if someone comes to you early? I mean, does early detection lead to better outcomes, more effective cures?
Thank you, sir. An excellent question. First and the foremost thing is, we have to start seeing cancer as an evolutionary process in one's life. The longer you live, there's a good chance that you will have a cancer. Longevity, living longer, is a significant risk factor for cancer. The lifespan in India, the average is about 70 years today. If we live up to 70 to 80 years, 1 in 6 to 1 in 7 of us will surely get a type of cancer. So longevity is a risk factor. So risk is really, what you carry with yourself, and risk is something related to environmental factors, what we call as reversible risk factors. Some people have cancers running in the families. These are genetic cancers. Age, longevity, we all want to live longer. That doesn't mean that we end ourselves soon. But the reversible risk factors are those which can be modified. It is typically the effects of westernization, so to say. The cause and the cure for all the ailments lies in the Mother Nature. The water pollution, the food which is contaminated, air pollution, obesity, stress, alcohol, fast food, fried food, moving away from the Eastern civilization or our own civilization and getting towards the Western practices, even as simple as the way we have changed our eating habits. the way we have changed our evacuating habits, all these have contributed to cancer. So, risk is a relative term. The absolute risk are the genetic risks, which only 5% of the population carry. The others are environmental factors, so to say, based on our diet, our lifestyle, and the stress factors we all go through.
Now, coming to recovery, we all know that it isn't easy to recover from the kind of treatment that you do, especially if there is extensive chemotherapy. Does it mean that a person recovers faster if the cancer is detected earlier? Will the cure be easier to implement and helps in getting the patient back to as he was before, a complete recovery, as you would say earlier?
The type of treatment we provide and the extent of treatments one receives is based on the stage of the cancer. For stage 1 and 2 cancers, more often than not, treatment is surgery. People recover from the surgery in a span of a week to 10 days and they attain a cure. For simplicity's sake, we always tell patients it's better to get an early cancer than getting diabetes, because diabetes is for life. However, early cancer is very temporary, so to say, a short journey you take and then it is forgotten. For stage 3 cancer, you might need some chemotherapy, more often than not after the operation. And for stage cancers, you will have to adapt other treatment modalities, and I think once you reach stage 4, it's a bit tricky. Not that we cannot attain cure, but the chance of that is less often compared to early stage cancers.
Dr. Simha, now given that very often you don't even know that you have cancer, how does a person realize or suspect that something could be amiss? What are the first signs or the first significant symbols that one should look out for and then immediately go for a checkup?
I think you have raised a very vital piece of question, sir. You are asking us, are there any early symptoms, early warning symptoms that we should be aware of? For that, I think it's very important for us to understand what a symptom is. A symptom is a manifestation which is not normal to oneself, cannot be explained by a reason, and has been persistent for a period of 4 to 6 weeks. For example, if we look at colorectal cancers or colorectal problems, somebody goes to the toilet once a day, every day, no change whatsoever. He has not moved houses, he has not moved to a different country, he has not changed his diet, he has not started any new medications, and he has had this change in his bowel pattern from once a day to 5 times a day. So here is somebody who has got a symptom which is not normal for himself, which cannot be explained by a reason, and which has persisted for 4 to 6 weeks time, and this is called as a symptom. Similarly, bleeding in the back passage, if it happens, this is not normal. It can be other cancers too. For example, woman, once she has attained menopause, she stopped her periods, suddenly there is further bleeding, this is a warning symptom. So likewise, it is very important, if something of this nature happens, the symptoms, it is wise to attend to a clinician who can talk to you. What do a lot of us do? We go to Google. The problem with going to Google is it makes you 2 things. One, it scares you, and it makes a well person a worried well person. I think that is the downside of Google or the internet-based information. What you need is a clinician who can sit and talk to you, find out what the symptoms are, and separate the dust from the gold. That is the reason you need to attain an appointment with a clinician who can sit, talk, give you time, and ask for the right test for the right causes.
Doctor, now coming to screening, how often would you recommend someone go and get themselves screened? I'm talking about somebody who is completely asymptomatic. Let's take age-wise, someone who's in their teens, post a little after teens, 40s, 50s, 70 plus.
Screening, I think it's a very sensitive subject, so to say. By definition, when we are treating the population, we say we can justify a screening when the prevalence of the disease is high, the incidence of the disease is high. So when it comes to colorectal cancers, the incidence of colorectal cancers is about 5 to 6 cancers per 100,000 population. So if you take 1 lakh people up in the street there, the risk is only between 5 to 6 patients. So when such is the incidence, which is small, albeit it is going up, I think justifying a nationalized screening, a routine screening becomes a bit difficult because we wouldn't gain too much on that screening. But what is important is if you are symptomatic, irrespective of the age, you go for screening. If there is a family history and there is a small suspicion, you go for screening. If there are family members at a young age who have cancers, you should start screening at an early age, maybe 30, 35, depending upon the type of cancers, and do it routinely at a variation between anywhere between 3 to 5 years' time. But it is really based on the disease processes, so to say, when it comes to high-risk groups. But as a gold standard, in the Western society, colonoscopy is the gold standard for colorectal cancers. So even in India, the patterns of disease are changing. You have the northeast of India where you see a lot of young patients with cancers. You have parts of Kerala where you see a lot of young patients with rectal cancers because of the environmental factors, them being red meat, dried fish, tinned fish, contaminated water with lead causing cancers. So when patients come from that areas, even at 20, 25, we are cautious and we get them to get a colonoscopy as a gold standard test. So it's really about teasing down the history, teasing down the symptoms, teasing down the risk factors, examining the patients and actually asking for the right test. So it is no one size fits all, it is horses for courses, and that is where clinicians do well, fare better compared to your Google, because Google will tell everybody to go to colonoscopy, which can have its downside too.
Dr. Simha, what typically does screening involve? Is it the same as a master health checkup? Does a master health checkup also cover cancer? Do you also recommend different types of screening based on the risk profile of the individual?
Sir, for colorectal cancers, the gold standard screening tool today is a colonoscopy. However, there might be situations where we think the patient might be at a small risk, but highly likely that he doesn't have a cancer, and if the symptoms suggest a lot of the problems are suggestive of a left-sided bowel pathology, we can utilize a smaller colonoscopy version called as a flexible sigmoidoscopy to rule out any pathology on the left side. So it is really the clinical decision, and the gold standard is colonoscopy, but you can utilize other lesser versions of colonoscopy to check the bowel. So the next question you was actually posed to me is, can the standard health checkups pick up cancers? See, as a part of the health check, people also say this will involve screening for colorectal cancer, screening for prostatic cancer, screening for testicular. So all male cancers are clubbed together as one. Similarly for women, breast cancers, cervical cancers are clubbed in, are packed in into the standard health checks. Unfortunately, what happens is, patients may develop cancers between two health checks. So they've had a health check in 2021, everything has been normal, and 6 months down the line, they have symptoms, and they should not ignore the symptoms, because what might be going through is a field change which your standard health checks will not pick up. So what is more vital in addition to the health checks is, if there is a symptom, get to your doctor. That's the vital thing.
Doctor, treatment typically involves many procedures. There are surgical procedures, there's chemotherapy, there's medications, and we know that many of these are quite painful and they take a toll on the physical capability of the individual. How painful is this treatment? Can you manage pain? Does it have a debilitating effect? After an extensive cancer treatment session, will the person get back to normalcy, like as they were before the treatment began?
It really depends what one perceives as pain and debilitation. We always say a short-term pain is worth a long-term gain. I think people really start looking at life in a different perspective once they've gone through cancer therapy. Pain can be physical, pain can be physiological, pain can be psychological, psychosocial, and even financial, not to be forgotten. When you do minimally invasive surgery with technology, the human touch added on to technology will touch lives with minimal amount of pain. No big scars, no big cuts, early recovery with minimally invasive surgery. And physiological pain. Patients have side effects from cancer therapy. And the precision-based medicine, dealing with targeted therapies, hitting the cancer cells with the right medications, right radiotherapy, and right aspect of precision-based surgery will help you with the function of that patient getting better, and they're not suffering debility and pain because of the functional problems. And when you do a minimally invasive surgery, patients get back to their normality quickly, better psychosocially, and even when you do minimally invasive surgery in colorectal surgery, we also preserve their pelvic nerves, which is a vital function for their sexual organs. So therefore, the psychosocial, sexual functions are better with minimally invasive surgery. Not to forget, they can get back to their normality working in the community, thereby decreasing the debilitation that happens because of financial constraints. So I think minimally invasive surgery scores very well on all aspects of physical, physiological, psychosocial, sexual, as well as economical fronts.
Dr. Simha, very often we hear of people going abroad for cancer treatment. How advanced is the technology available in India now? Do you really need to go abroad? Is India good enough to handle even the most complex and difficult cases?
We in Sanskrit say a word, we call it as Vasudhaiva Kutumbam. World is a one place. The world is a much shorter place today. With so much of technology around the world, everything that can be availed in any part of the world can be availed right here at Apollo hospitals, right here in Bangalore. For a surgeon, surgery is not a difficult thing. What is difficult is the decision making. Is this the right treatment for the right patients? Am I treating the cancer or am I treating the person with the cancer? I think the person becomes more important here. And what is difficult for all of us is the decision making process. That is the reason we utilize our tumor boards, regional tumor boards, without which decisions are not made at all for the patients. Cancer decisions are made in the tumor boards, and sometimes we utilize the national knowledge and skill available through national tumor boards when there is a complexity in the case, and then we get the patient involved in the decision making process to do what we call as a joint decision making. So decisions are more difficult than incisions. I think that is the most vital aspect of it. In terms of knowledge, we have it all. In terms of the skill, we have it all. In terms of the technology, we have it all. And the quickness with which we get it done is much quicker in India. So I think there is no need to go to any part of the world when right here, right now, everything is available, what is available in the rest of the world.
Doctor, these are times of minimally invasive procedures. We hear of them in every branch of medicine. Has cancer surgery also become less invasive and therefore the recovery time is faster and it is less painful?
The last decade has seen a revolution in healthcare. What has happened is the technology has become a partner with the touch from the clinicians. The traditional open surgery is actually augmented by minimally invasive surgery, where we use laparoscopic instruments, and now robotics has come into play. When there are cancers which cannot be reached out with surgery and which might leave the patient functionally defective or deficient, we have the proton therapies which can burn these cancer cells to the utmost precision of a cell. So I think the technology has brought in a huge advantage in terms of precision-based surgery and precision-based therapies, and minimally invasive surgery certainly has made a big leap in quicker operating, maybe not quicker operating, but quicker recovery, discharge from the hospital much quicker, return of patient to their normality or back to the community much quicker. The learning curve with the technology can be sometimes a bit longer. See, I used to take a bit longer for my robotic operations 2 years ago than what I take now. So I think the minimally invasive surgery we call slow is fast. So the slower you are, the quicker the patient recovery and quicker he gets home with minimal scars, not much bigger cuts, quicker return of bowel function, quicker return of the patient back to the community, and fantastic surgical outcomes in terms of cancer resection.
Dr. Simha, the treatment always has side effects, especially in the case of cancer. We hear of people losing their hair. We hear of severe side effects, especially when chemotherapy and radiation is involved. Now with the advancing technology, have you brought down the side effects? Is it more manageable? And also, are these side effects lasting or temporary?
This is what we call as precision-based medicine. We don't give just medications for the sake of it. We try and figure out what is the nature of the cancer. It's an adenocarcinoma. Is it a poorly differentiated one? Is it a moderately differentiated one? What is the character of this cancer? And is it in a native wild form, or is there a mutation within these cancer cells? So we try and figure out the nature of these cancer cells and try and hit them with targeted therapies, because the side effects associated with generic medications, general chemotherapies, are brought down with precision-based, targeted, so to say, catering for that particular tumor, for that particular patient. This precision-based medicine has certainly made things better, and the complications that we cause to them are much, much, much lower, so to say.
Doctor, automation is something that is playing a huge role in every sphere in life. It's a game changer. What role is automation playing in cancer? Are you using robotics more often? Has the skill sets of surgeons and cancer specialists changed now with automation?
I think the last 2 decades has truly made a huge difference to the way we care for our patients. The touch, the technology, and the way we touch people has changed. There has been a clubbing of touch and technology for better patient care, thereby touching people. Artificial intelligence, technology in terms of robotics, precision-based stratified medicine, and automation. All these things are driving patient care for better outcomes. What has happened so far is a fragmented approach of artificial intelligence, of technology when it comes to adaptation to patient journey. It is done in points of care rather than all the points of patient journey. So AI, technology can be utilized to figure out which patients might benefit from a screening test based on some of the questions we asked. Next, moving on from there, the histopathologies that are undertaken can be screened, can be adapted into AI protocols and algorithms to say whether we are looking at cancer care or whether we are looking at cancers at all. X-rays, CT scans. So all these have taken a big leap when it comes to utilization of technology. However, the whole patient journey is not covered. We still have, reducing this time lag, making the journey faster when somebody comes in with the symptoms. Have you had your colonoscopy? Yes, no. Have you had your CT? Yes, no. And directing them, shortening the waiting period and getting them the right treatment based on the tumor board outcomes, and at the end looking at oncological outcomes, looking at patient outcome measures, and how we can make this circle quicker but at the same time keeping up the quality is something we have to work on. So there has been a lot of work on artificial intelligence, robotics, precision-based stratified medicine. However, the automation linking all these points of care has to be done so that the whole journey can be mapped for better patient care.
Doctor, it's a proud moment for all of us to say that India has the best of talent in medicine. We have surgeons such as you in India. Has India become a center for medical tourism? Is India playing the role of US as that US played at one time, that is drawing patients from all over the world?
We are privileged to be where we are. Apollo Hospitals, the largest corporate chain in India, not only attracts patients from Asian countries, from SAARC countries, but also from the Middle East and a huge chunk of African subcontinent. In addition to Central Europe too, some of the countries from Central Europe. I think there is knowledge, there is skill, there is technology and excellent clinical care outcomes. So when it comes to medical tourism, I think Apollo has made a huge difference to healthcare around the world, especially the developing and the underdeveloped world. So the answer for your question is yes, we are huge into medical tourism and there are hospitals which dedicatedly cater to the international patient clientele.
Dr. Simha, now a key question. How do we prevent cancer?
I think an excellent question, sir. We are asking what are the risk factors or how can we reduce the risk of one getting cancer? How can we prevent cancers? That is the question you're asking. I always tell people, Mother Nature is the cause and the cure for all ailments. Look after the Mother Nature better. Look after the water without polluting it. Look after the air we breathe without contaminating it. Look after the food products we eat without putting things like pesticides, fertilizers. And the rapid urbanization has to be brought down. That is what is the key cause for your water pollution, soil pollution, and air pollution. Secondly, I think moving away from the Western civilization, so to say, and holding on to traditional cultural habits goes a long way in preventing cancers. It could be as simple as sticking to our traditional home-cooked food, which is a balanced diet with proteins, carbohydrates, grains, spices, minerals, vitamins, followed by other appetizers and things that aid digestion. Even things like sitting on the ground and eating helps in digestion, thereby preventing, untoward effects from the food we take. I would say the three things that the Westerners have given us, which are actually not a boon, but a bane, are the dining table, the microwave, and the Western toilet. All these three have created a big havoc in terms of causing problems with us, and I would like to say that some of these are contributing to the gastrointestinal cancers we see, especially the colorectal cancers we see, the food we eat, the way we eat, the way we evacuate. All these things matter. Stress, another big factor. Obesity as a consequence of alcohol, intake of fatty food, intake of red meat, lack of green fiber, and lack of physical activity. I think there's a nice Egyptian proverb that goes, a quarter of what you eat is for yourself, the other 3/4 is to the doctor there. So I think it's important you keep the calorie bank balance zero at the end of the day. Eat healthily, go to exercise, undertake physical activity, and have a process in your mind, whether it's about praying, meditation, yoga, to keep your system calm. Because the strongest aspect of your whole body is the hypothalamus. A stronger hypothalamus triggers the pathways for a robust immune system, and this is what we call as psychoneuroimmunology. A robust psychology leads to robust immune system, and a robust immune system prevents cancers and also kills cancer cells much quickly. So the answer for your question is eat well, exercise well, sleep well, reduce the stress, cut down on alcohol, bring yourself back away from the Western civilization, and try and see if you can get back to what we were, maybe 30, 40 years ago. Getting back to our cultural roots will certainly be of help. This is with regard to the environmental factors. And be aware, cancer is not a disease, but it's a phase of one's evolution, and seek help at the right time. The small portion of genetic cancers, 1 in 20, if you should be aware that's in the families and get quicker screenings to get that sorted. I think that's what I would say, sir. Eat well, drink well, exercise well, stay away from stress, a healthy lifestyle, and move away from the Western civilization. This should cut down on the cancers.
So there you have it. It's always better to know K-N-O-W than live in denial and say N-O, no. Why be scared when you have talent like Dr. Simha right here? Understand what he says, stay safe, and don't be scared.
The vision of the Apollo Group is to touch 1 billion lives, and the commitment to patients' care on uncompromised, tender care love. It is this commitment that makes Apollo Hospitals Bangalore the preferred medical destination for patients from over 120 countries. Come to Bangalore to experience the expertise of one of the finest institutions in healthcare.